Okay, good afternoon everyone. Welcome to the webinar in preparation for World AIDS Day. Coaches Across Continents welcomes everyone who joined this webinar. And we are also very happy and delighted that we can welcome another guest speaker this month. As you can see already on the first slide, Dr. Jenshi Dorward, working for Caprisa here in Durban, South Africa. He will say a little bit more about himself and what he does in a few minutes. We are very happy that he is said that he would like to or would be able to present a couple of facts and about HIV, AIDS, about the research in HIV, and about the most recent findings in terms of vaccination and also HIV cure. Jenji is a good friend of mine who works here in Durban, so I'm very happy to welcome him, and I'll make him a moderator now, and then he will be able to introduce himself. Enjoy the webinar, and as always, if you have any questions, please type them on the bottom right, and we will try to get back to you and answer them as quickly as possible. And yeah, talk to you later then. Thank you. And don't be confused, Jenshi is logged in with my name and will use my account, so it just doesn't confuse you. Welcome, Jenshi. I'm opening the floor for you.
Brilliant, thank you. Thank you for the introduction, Marcus, and hello everybody. My connection just cut out there for a second, so I hope that won't be an issue as we go forward, but let's see how we go. So I missed some of what Marcus said about me. So I'll give you a little bit of background about myself, but first to say I'm very pleased to join you guys, and I hope that this will be an interesting session and helpful for you as you look forward to World AIDS Day on the 1st of December. So I think, as Marcus said, I'm a medical doctor. I trained in the UK, where I'm originally from, and I trained in family medicine, but then I've spent several years now working in South Africa, mainly working in HIV and TB services. And for the past few years I've worked as a researcher looking into HIV for an organisation called Caprisa. So Caprisa stands for the Centre for AIDS Research in South Africa. And it's been going several years, and they do many different studies, but mainly looking at trying to prevent HIV, also treating HIV and TB, and then recently looking for vaccines and looking for a cure. So I think probably you all will have different levels of knowledge about HIV. So in this talk, I'm going to start from the basics, but maybe towards the end we can talk about some of the more recent science, depending on what your questions are. So let's get going. And let me just move the slides on. So this is what we're going to talk about. I'm going to briefly go into why and what World AIDS Day is, then a little bit about what is HIV/AIDS. I'll then give you a little update on the state of the epidemic of HIV/AIDS around the world. We can look at what's happening in a few different regions around the world. We'll then talk about treatment for HIV, which is known as antiretroviral therapy, or ARVs. And then we'll talk a bit about the future, so maybe new research or new things that are happening in the field of HIV science. And then lastly, a little bit about kind of the personal implications of HIV. If I'm going to try and have space and time for you guys to ask questions, but if while I'm talking you have any questions, please just write them down, put them in the chat, and either we can answer them straight away, or maybe I'll save them up for the end. But hopefully this can be good and interactive. Okay, so moving on. So, I mean, what is World AIDS Day? Well, it's a global day of action on HIV/AIDS. It's organised by the World Health Organization and several other international health organisations, and it serves kind of a few different purposes. So, the first is it's a day to get the facts, to learn more about HIV and AIDS, and to be to understand more about what it is and how it can impact us. It's also a day to show support for people who are living with HIV and AIDS, and it's also a day to remember, I mean, for many people who've been quite severely affected by this illness, it's also a day to kind of remember them as well. And last of all, we'll come to this, it's a day to get involved, and I think that's, from what I understand from what Marcus has been saying, that's what you all are going to be doing, and the purpose of parts of this program. So, next slide. So just quickly, what is HIV? And some of you will probably know this all already, but I'll just go through it quickly. So HIV stands for Human Immunodeficiency Virus. So the human bit, I think we're all going to understand. Immunodeficiency means that it attacks the immune system in the body. So the defenses that our bodies have to fight infections, to fight cancer, to fight illness, that's very important in keeping us healthy. And the HIV virus attacks the immune system. And specifically, it attacks part of the immune system called CD4 cells. So some of you will have heard of this as well. And CD4 cells are cells in your blood that protect you against cancer, protect you against infection. And so the V in HIV stands for virus, and so this is a small, like a bug, very, very small bug. You can only see it under a very powerful microscope. And if that infects a person, it will attack their immune system and attack their CD4 cells and make them weak, make their immune system weak so that other infections and cancers can make them sick. So in summary, it's a virus that damages the immune system and reduces the ability to fight off infections. So that's HIV. What about AIDS? So AIDS is more a condition. It's not a virus or a bacteria in itself, but it's the result of the HIV virus. And so AIDS stands for Acquired Immune Deficiency Syndrome. And basically what it is that after several years of having HIV, with the HIV virus attacking the immune system, a person's immune system will become very weak. And at that stage, they can then get many infections that they wouldn't normally get. For example, brain infections, eye infections, lungs, skin, stomach infections, or even cancer. And all this is caused by the HIV virus damaging the immune system, so that they have no protection against these other illnesses. So that's the definition of HIV and AIDS. I think the next is a kind of question for you guys, and I'll give you a minute or so just to type things up, but there are several different ways that HIV is transmitted. So I just wondered if you could just jot down and tell me the ways that you know about that someone can catch HIV, and then we can go through what are the most common ways and which ways people don't really get HIV. So if anyone's got any ideas, please just put them into the chat, and then we can discuss this. I'll just give you a minute or so. Don't be shy. So I can see we've got sexual transmission, unprotected sex with an infected partner, sharing of needles from Jordan. That's good. Any other ones? So there are a few other ways. Yeah, sexual transmission, and as Charles said, particularly when you're having unprotected sex, so sex without a condom, that is probably the main way that HIV is transmitted. So blood transfusion, yeah, so HIV infects the blood, and so if someone is given a blood transfusion and that blood hasn't been checked and tested for HIV, then people who receive that blood can become positive. That used to be a problem earlier in the start of the HIV epidemic, but more recently blood transfusion services now do very rigorous screening and testing to make sure that shouldn't be a risk. I can see, Elvis, you said by birth also, so that's a really important one. So if a mother has HIV and she gives birth, then the virus can either be passed to the baby during pregnancy or during labour when the birth is born, and also through breastfeeding. We'll come to talk about that a little bit later. So I think you guys have pretty much covered everything. So multiple sexual partners, yeah, so that's true, because but only if you're having unprotected sex. And if you're using condoms and having multiple sexual partners, you can still have safe sex with many people. So the key is about using the condoms, but also, of course, the less people you have sex with, the less chance there is that someone could transmit. See, Jordan's asking, is there a case where HIV is transmitted through sport? I've not heard of one. The thing about the HIV virus is it's very unstable. So if blood is outside the body, it won't last. The virus won't stay alive for that long. So okay, can you hear me now? Sorry about that. I hope that doesn't happen again. But okay, so well done. I think we should move on. You answered a lot of the questions there. I was just saying that the virus is very unstable outside the body. So while you were right that by sharing a knife in a kind of circumcision which hasn't been cleaned, there is a risk of HIV. It's not so common. So these are the reasons, and you guys got the main ones, and you got most of them. And it's just really important to emphasize that you can't get HIV by kissing or hugging or shaking hands, by sharing kind of eating utensils, or kind of normal everyday social contact. So all those things, you cannot transmit HIV, and that's really important for to know and to make sure that people are aware of, so that people who are HIV positive don't get stigmatized against. Okay, so let's move on. So this is a little bit, I'll just go through this quickly, looking at the global HIV epidemic. And recently there's been talk of the end of AIDS. And the reason for that is kind of in this graph. So in the top you can see 70 million people have been infected with HIV since the beginning of the epidemic, which was probably started in the 60s, but people first became aware of in the 80s. And of those 17 million, about half of them died. And so, as I said before, that's one of the functions of World AIDS Day, is kind of to remember the huge ways that this virus has affected people and societies. But the great news is that things are getting much better. So I want you to look at the graph here on the left. So you can see it's a graph of the number of thousands of deaths per year. And in the year 2003, there were nearly 2,000, so 2 million deaths a year. But over the last 10 years, this number has dropped by half, which is really great news. So you can see on the right that actually it's even better news amongst women compared to men, and we don't fully know why, but it's probably because of men generally are less likely to test for HIV, they're less likely to take treatment for HIV. So this good message of less deaths, just breaking it down by country here. So if you look on the graph to the left, this is looking at Asia and parts of Africa. So in Eastern and Southern Africa was the worst affected area, with over 1 million people a year dying in 2004, 2005. But look how quickly this has dropped now and really halved, and that's really great news. And we'll come to why in a minute. And then if we look on the right, this is looking in in Eastern Europe, Central Asia, Latin America, Middle East, and North Africa. And I just want you to make sure that you can see that this graph is it's up to 60,000 on the top left. So if we were to put it into the main graph, it would be right down here at the bottom corner. So the scales are different. So just to be very aware of that. But you can see that in most regions, again, deaths are coming down. Yeah, so thank you for highlighting that. So it would really just fit in that little corner down at the bottom left. But the important thing to see is that the good news isn't everywhere. So if you look at this blue line, there's one line which is really rising, and that's in Eastern Europe and Central Asia. And that's probably because they've been very slow to be aware of HIV and to organise testing and treatment programs. In other places it's pretty stable or going down. Okay, so why has this happened? So I can see Charles is saying things are getting better with people protecting themselves. So yeah, maybe that's true. There's been a lot of people were trying for a long time to get people to change their behaviour and to practice safe sex, abstinence, be faithful. There wasn't that much evidence that really worked. So we'll come on to talk about what does work now. So let's look at. So I just wanted to ask this question first, and this leads on to what we're going to talk about. So how long does an HIV positive person live? What do you think are the things that, if someone was to get HIV today, say a 20-year-old person, how long would you expect them to live for, and what would be the things they could do that could help them to live longer? So I see, Vincent, you're saying as long as a person without HIV. So I do agree with that, but there's a certain something that's going to affect that. We just saw HIV killed 35 million people, so yeah, what are the conditions that will let someone live as long as someone without HIV? Yeah, so Jordan's saying receiving treatment. So yeah, so Charles, you're exactly right. So taking ARVs, and then generally staying healthy. So as a doctor, I would advise everyone, whether they're HIV positive or negative, to have a well-balanced diet and do some exercise. So everyone should be doing that. We should all be doing that. But if you're HIV positive, the thing that's going to really make a difference compared to someone who's negative is taking treatment. Yeah. And so your estimate of 15 years, yeah, so Athria, I hope I'm saying your name correctly, 30 to 40 years if you take proper treatment, and that's more like it. So recent evidence, so the most recent science suggests that if you detect the infection early and start treatment early, your life expectancy can be pretty much the same as someone who's HIV negative, like as Vincent said. So that's really great news, and that is the main reason why those graphs were all coming down. Because in regions where HIV testing is available and where treatment is available, then you can have a nearly normal life expectancy. So let's move on to the next slide. So this is a picture of Magic Johnson, who's lived probably 30 or more years now with HIV. And that's because of being able to take treatment early in infection. So this Magic Johnson's a basketball player in the US. Yeah. Good. Okay. So I think everyone seems to be up to speed with that. And this is the treatment. So in the beginning, in the 80s and in the 90s, the first antiretrovirals were very difficult to take. They had really bad side effects. There were a lot of tablets. You had to take them with food, without food. It was very complicated. Now we've got new treatments where all of the different drugs are combined into one pill, meaning that in many countries you just have to take one tablet a day. And if you manage to do that, you'll have a normal, healthy life. Not everywhere has got the treatment in one tablet. Maybe sometimes it'll be 2 tablets, 3 tablets, but in general, the drugs are cheaper now, they're more effective, and the side effects are much, much less. And actually, soon, in the next few years, they're going to be bringing out even better drugs that are more effective and have even less side effects. So yeah, we've already mentioned that side effects are few, and yeah, in many countries they're free in the public sector. So where Marcus and I live in Durban, this area has got one of the highest numbers of people with HIV in the world, and here treatment is provided for free by the government. Okay, so unless you guys have got any questions about ARVs, I'm going to move on. So this is how they work. So what they do is they stop the virus from reproducing in the body, and they can do this so effectively that when we take blood from someone, we actually can't see the virus because it's so it's been suppressed by the drugs. And so because there's very little virus in the blood, it allows those CD4 cells, which I mentioned earlier, to recover. And so with higher numbers of CD4 cells, this protects people and protects the body from infection and from cancers. And that's why people can have a normal life expectancy. Unfortunately though, the drugs can't completely clear the virus from the body. And so if someone stops their ARVs, the virus will come out of the various places where it hides. So it hides in the brain, it hides in nerves and other places. So if someone stops ARVs, the virus will come back into the blood and cause problems. So it's really important that people take their treatment every day for the rest of their lives, as most of you have already said. Okay, so just very quickly, the origin of HIV. I see Elvis is asking. So there's been a lot of speculation about that, and a lot of the speculation is wrong. We don't have a definite answer, but most likely we think it did come from animals, because there's a very similar virus that infects monkeys. And so it's likely that this virus at some point managed to jump from a monkey to a person, probably when the animal was being hunted or killed for bushmeat. So that's the leading theory. Okay, so antiretrovirals. So we've talked about how good they are at treating HIV and helping people to live longer. But something which is really important is that they also stop people from being so infectious. So as I said, the ARVs are really making there be very little virus in the blood. And it also means there's very little virus in the semen and in the vagina, so that during intercourse it's much less likely for someone to pass on the virus. The same is true in pregnant or breastfeeding mothers, that if they're taking ARVs, there'll be so little virus that they also can't transmit to their infant. And so those things are really important for thinking about how the epidemic is going to progress, and we're going to come on to that in a minute. Secondly, you can also use ARVs to stop yourself from getting HIV if you yourself are negative. So if someone's HIV negative, they can also take antiretrovirals to protect themselves from becoming positive. And that's something called pre-exposure prophylaxis, or PrEP. And that's been available in countries like the United Kingdom and the US for a few years, and it's now being rolled out across the world. And as part of kind of the World Health Organization guidelines for prevention of HIV. Okay, let's quickly move on. So this is kind of the current thinking amongst the World Health Organization, amongst many research organizations, about how we might be able to end the AIDS epidemic, get control, stop there being new infections, and stop people dying from AIDS. And so these are targets called the 90-90-90 targets. I'm just going to go through them really quickly with you. And the idea is that to do anything about HIV, first, people who are positive need to know that they're positive, and so they need to test. So it would be great if we could get 90% of everyone who has HIV to do a test to know that they're positive. And at the moment in the world, it's probably around 50 or 60%. So there's lots and lots of people who are HIV positive, but they don't know that they're positive. And if you don't know, you can't do anything about it. The next 90% is we'd like 90% of people who know that they're positive to start treatment. Okay? And this has also been a problem because there's lots of people who do a test, but for whatever reason, maybe they don't want to go to a clinic because they're worried people will find out about their HIV status. Maybe they can't get to clinics, maybe the clinics are very poorly run. So we know that a lot of people who test actually don't start treatment, even though, as we've seen, the treatment is really effective. But if we could get this up to 90%, that would also be really great. And then lastly, we want, of those people who are on treatment, it would be really great if 90% of them could take it so well that the virus was really, really low in their blood, so that basically they wouldn't be able to pass it on to anybody. And it would also benefit their own health, as we've already seen. So these are called the 90-90-90 targets. And when scientists look at kind of the figures and work things out, we predict that if we could do this, if we could reach these 90-90-90 targets, it would mean that actually the epidemic would begin to end, because there wouldn't be enough people who've got lots of virus in their blood to pass it on. And so we'd be able to reduce new infections, and we'd also be able to reduce deaths even more. And so that's how one way of trying to get to the end of AIDS. Okay, I'm going a little bit slow, so I'm going to try and speed up. So how can you protect yourself from getting HIV? So you guys, if you could give me some answers, but I'm going to start going through things as well, just to save time. So I think we've already mentioned using condoms. We've already mentioned taking ARVs if you're HIV negative in something called PrEP to stop you getting HIV. But any other ways that you can protect yourself? Actually, I think we also mentioned not having a wide sexual network, so having less sexual partners. I think someone already mentioned that. Getting tested regularly so that you know your status, you can do something about it. Not having sex, using condoms. Those are all good suggestions. So let's. Some of the things we haven't mentioned then are medical circumcision. So this is for men. There's really good evidence that men who are circumcised are much less likely to get HIV, about 40% less likely. It doesn't mean you can't get HIV. You should still use condoms. You should still do all the other things to protect yourself. But if you are circumcised, for a man, it's much less likely that you will get HIV. Second thing is, if you have sexually transmitted infections, those can cause sores, they can cause little cuts in the skin, which make it more likely that you can get HIV. So people who have unprotected sex should always make sure they get tested for get tested for STIs if possible, and get treatment for them if possible. So those are some of the things that individuals can do. This very busy slide is looking at all the different things that have been proven, scientifically shown to prevent new HIV infection. So we've mentioned quite a few: circumcision, treatment of STIs, condoms, testing, being faithful, treatment as prevention, which is what I've talked about, the 90-90-90 targets, pre-exposure prophylaxis, and then microbicides for women. And this is something that there's lots of research going into, looking at using antiretroviral gels as a vaginal gel to reduce the risk of getting HIV. And there have been some studies that showed that that worked, and other studies that showed that that didn't work. And so that's something that's still being researched. And yes, the good use of condoms is to not use two at the same time. So I think in the pack that Marcus is going to introduce later, there's a bit more about how to correctly use condoms. Okay, so just moving on. I'm going to skip this one. Okay, so very quickly then, this is pretty much near the end. Just thinking about the future. So people have been looking for a vaccine to prevent HIV for a very long time. So I'm sure you're all aware that vaccines are really good at preventing lots of different diseases. And if we could get a vaccine that worked against HIV, that would be a huge step towards ending the HIV epidemic. And despite all the investment and research that's been going on for 20 to 30 years, we haven't yet got a good vaccine. However, in the last year, a very promising vaccine has been developed. Actually, two very promising vaccines have been developed. And at the moment, those are being researched in several sites across the world. And actually, the clinic that I'm in right now, we're one of the sites which is testing this vaccine. And they expect the study will take probably 3 or 4 years. So for anything to be ready, to be used in the general population, it's not going to be ready for at least 5 to 6 years from now. But we're hoping that one of these two vaccines might be able to show good effects and be useful in preventing HIV infections. Some of the other things on the horizon are types of ARVs that you don't have to take as a tablet, but rather that you could either inject or you could have as a small little implant under the skin. And this would slowly release the antiretroviral and would mean that adherence isn't so much of a problem. I see someone had mentioned adherence being a problem, and that is a problem, that people don't manage to take their treatment every day. But if you had an injection that lasted 3 months, or an implant that lasted 2 years, you would just have to go to the clinic much less frequently and have treatment given this way. So those are some of the things. And at Caprisa, we're looking at an injectable antiretroviral, and that study is starting in the next few years. And then lastly, finding a cure. And so this is a question that people are intrigued by, and again, scientists have been looking at for a long time. And the problem is that HIV, as I said before, it hides very well in the body, and it's very difficult to get it to come out of those hiding places and get drugs to it in those hiding places to get rid of it. And so at the moment, there is no cure for HIV, and the prospects of one, although progress is being made, are not that great. And so at least for the next 10 years, we're going to have to look at other things, because we're not going to have a cure for HIV within the next 10 years. Okay, just try and get towards finishing up. So this is just about, as we said before, the first thing to do, the first kind of personal step that people can take is, if you think you might be at risk of having HIV, which means have you ever had unprotected sex, or any of the other things that we discussed earlier, then you should do an HIV test. And the reason being that if you're HIV positive but know your status on antiretrovirals, then your life expectancy will be long, risk of other infections including TB will be less, and transmitting to someone else, the risk of that is much less. But if you're positive and you don't know your status, then the opposite is true. And so the first thing that people can do is get tested themselves and encourage people around them in the communities to also get tested. And this is basically saying the same thing. So for people who are positive, who are HIV positive, then as we've already said, starting treatment is the most important thing. And the last line is still crucial, because although HIV doesn't need to kill people anymore, it still does. And one of the main reasons for that is stigma and discrimination. And so if we could somehow get rid or reduce stigma and discrimination, it would definitely be easier for people to test, it would be easier for people to take treatment, and that would in itself save lives. Okay, so I was waiting for the next slide to come up. So to acknowledge two of my mentors here who've been doing a lot of work with regards to HIV research. And then a quote, as I'm in South Africa, a quote from Nelson Mandela for you. "History will surely judge us harshly if we do not respond with all the energy and resources that we can bring to bear in the fight against AIDS. We must never forget our own responsibilities." So there you go. Okay, I overran slightly. I don't know, Marcus, if you're happy to take a few questions, if anyone's got any other questions.
Yeah, I don't know if you want to respond to the last question, Genchi, that has been posted on the bottom there. The proper procedure once somebody has found out that they're HIV positive.
If someone's found out that they're HIV positive, yes, I mean, the first thing to do would be to make sure that you attend a clinic, a reputable clinic, and try and get treatment. And it used to be that we would only start people on treatment after a certain time, after their immune system had got weaker. And now there's really good evidence that it doesn't matter when someone was infected with HIV, it doesn't matter how high or low their CD4 count is. It's definitely better for their health to start ARVs as soon as possible. And so the main thing, if I could kind of give one piece of advice to someone who just tested positive, it would be to do whatever you can to get onto treatment. Because that is the one thing that's going to make the most difference and improve your health a lot. I can see Elvis, why did they choose the 1st of December as World AIDS Day? I'm afraid I don't know. I don't know about that. I don't know if anyone else knows.
I also don't know. No.
Might have to quickly Google it.
If somebody wants to Google or find it out or share because they know. I would like to add one thing in terms of the question that Karanendo brought up, is that when you go to a clinic where they test, at least that has been my experience, and I've worked in a clinic where they tested for HIV, they have their procedures and their protocols that they follow. And some of these aspects is also confidentiality. So the person that has tested you will never reveal to anybody outside the counseling room your HIV status, no matter if it's positive or negative. And they usually also advise you, and they're obliged to give you counseling after, if they found out that you're HIV positive, what the next steps are. Where do you get treatment? Where can you go? Who is the doctor to contact, and things like that. So probably Genshi knows more details about it, but I know that these counselors who do HIV testing are very well trained, at least in the places that I have been to. Yeah,
so
that's
Charles
great.
Saying that you've got 1st December activities, kick and test. Yeah, that sounds brilliant. And the VMMC, so voluntary male medical circumcision. So that's really great to get guys to get circumcised and spread the message. So it sounds good, Charles.
Okay. And I think that's also a good transition to what I wanted to talk about in regards to the packet. Since you have the activities planned already on 1st of December, and those of you who don't have yet, probably this can be an inspiration for you to plan something, to plan an activity, no matter how small or big it is. But first, before I move on to that, I want to say thank you to Genshi for doing this great presentation, and I feel very inspired and empowered by knowing now all these most recent facts and details about the research. I feel like I'm now much closer to what's going on in this field, and I feel it's certainly empowering to feel like, oh yeah, there's so much going on every day. People like you, Genshi, are working on finding a solution while we working with the current tools that we have. There's so many people around the world that are trying to find a solution that brings us even closer to getting rid and fighting and winning the battle against HIV and AIDS. That's certainly inspiring, definitely for me, and I'm sure I'm speaking for everybody else on this webinar as well. So thank you, Genshi.
No, thank you for having me. I hope it was useful.
Okay, there's one more question, so let's quickly answer that before we go to the packet. People often ask if a usual blood test can show if they have HIV or not. I will let the doctor answer again.
So it just depends what kind of test is used. So you can do the type of blood test where it's just a finger prick. When they prick your finger, they put a drop of blood into a little strip, and after a few minutes read that, and that can give you a result, positive or negative, and they're generally very reliable, very widely used. But then also you can take blood, like a tube of blood. You can also send that to a laboratory, and that can also be tested for HIV, and that tends to be very, very slightly more reliable. But as Marcus was saying, it's really important that people who are testing for HIV are counselled properly and consented properly. So no doctor or nurse should ever take blood and do a test without informing someone what tests they're going to be doing. I hope that kind of answers your question.
And I think also to probably add on that, so the blood needs to be tested for HIV. I think that's also a little bit what Lorik means. A usual blood test, if you test for, like, I don't know how much iron you have in your blood, that blood test will then not tell you if you have HIV. Like, you have to test and look for that virus in your blood. Only then you will have to find out and be able to find out and get the result.
Yeah, exactly.
Just to add that on what Genshi has already said. Okay. So I will briefly, I will not now go through the whole packet. We will spend now probably another 5 to 10 minutes, and then we will be done with the webinar. So thank you very much for staying on for so long. I want to just highlight a couple of things that are new and different in this packet compared to other packets. You've probably already seen, and I hope many of you have probably had a quick look already into the packet that has been sent out over the weekend. We apologize that there's been delayed for a few days. We had some technical issues and therefore we couldn't provide the packet earlier. But those of you who have looked already, had a look already into the packet, it's our regular role model that also is the role model for our regular HIV packet, Michael Ballack, who's already now retired, but UN AIDS International Goodwill Ambassador since 2006, and therefore the role model for our HIV games. We have developed a completely new curriculum that we will use in future, and obviously it was a great opportunity to now use these games also for the World AIDS Day packet. And something that is new in this packet is that we have added 2 pages of myths and facts about HIV/AIDS and sexual health. I will not now go through all the different myths and facts, but I think they are tackling some of the most common myths that exist. And I know that we all come from different places, and some myths exist in some places and other myths exist in different places. So they probably might not apply all to your situation. I had to select 10 that I thought are most important or most viable for the places that we work in and that curriculum will be used. And related to these myths, we have put then also always the fact to it, because I think, and that's also something that this webinar was supposed to provide, is to have information, to have knowledge. As Genji mentioned earlier, HIV as a virus in your body nowadays doesn't need to kill a person anymore, because we have ARVs, because we know how we can get the virus load low in the body. But stigma can certainly kill, and prejudice can certainly kill still people mentally and emotionally, and in some stages probably also physically. And that is the reason why we have added these myths and facts. So you as a coach, you as a facilitator have the opportunity to inform yourself, and probably also get information should you face myths, should you realize that your players, your participants are coming up with questions or coming up with statements that you think like, are they really true? And then this can hopefully help you to provide correct information. So yeah, I think these myths and facts can certainly be included in the games and in the on-field activities. And on the bottom of the second page, there's also the references that we have used for these myths and facts. And there's many more statements and many more myths that you can research and that you can find out about just by following these links that are provided here on the bottom of that page, where I'm there with the cursor right now. If you look into the packet and follow these links, there will be many more information for you if you want to research more. This packet is also provided in Spanish and in French. I'm now going here through the English version, since English is the only language out of these 3 that I speak more or less properly. So yeah, if you want a different, I think we have tried to cover all the different packets, all the different languages that you need. So if you request or need a different language than English, please let us know. I will not now go through the specific games. They are all new. We have, as I mentioned before, created 5 new games that we have now added to the curriculum for World AIDS Day. Ballack protects his body, focusing on the aspects of how to protect your body from getting infected with STIs and with HIV, getting all these protection methods that Genji has been talking about during this webinar also implemented in this game. I think a great fun game. And then the second game, Ballack Play Safely, also about sexual and reproductive health, HIV/AIDS prevention, and healthy choices. Can also focus on like unwanted pregnancy, since we have talked a lot today about HIV/AIDS infection and STIs. One other aspect that is a massive issue related to sexual health is unwanted pregnancies. And I think this game can be used for that aspect as well. Then moving forward, another game, Bala clears up HIV and sexual health myths. So that's a great game that can also actually implement those myths that are mentioned at the beginning of this curriculum into a game situation. I think I would really love to hear more feedback about this game. We have never actually implemented it on field, but it would be great to get some more feedback about that and to clear the field from all the myths that are related to HIV, AIDS, and sexual health. And then the second last game is Balak encourages taking ARV treatment. We have heard today from Genchi how important it is to adhere with your ARV treatment. I think this game can illustrate very well how does the body react if you stop taking your ARV treatment, and how does your body benefit if you continue with your ARV treatment. Fun game, and I think a very strong message as well. And the last game, Balak fights stigma in the community. I think we have stressed this point now. Stigma is one of the main aspects that can still kill people. And I think this game can illustrate it very well as well, how certain people are excluded from receiving passes in the game at the beginning, representing the people that are HIV positive and stigmatized, that people separate from. How does it make you feel? How does it affect those people that can't receive a pass from one of their teammates? And then talking about solutions to overcome those stigmas, these stigmas, and include people in the society, include them in your community, and applying it to the game, including them into your team. So that's the quick go through for these games. And then the last page I think is very important as well, because it contains all the information where you can get more information about World AIDS Day, where you can get more information about coaches across continents, and especially also where you can publish your photos and videos and stories. We would really like you to post them and send them to charlie@coachesacrosscontinents.org. So this is now the last slide of the presentation. We would really love to hear about your coaching experience with these football activities that will be now implemented for the first time worldwide for World AIDS Day this year. So please share your photos, your videos with us, and we would be more than happy to share them on social media, on our webpage, on Facebook, on Twitter, similar to what we do on International Women's Day and on our International Peace Day. We would like to continue and repeat that for World AIDS Day. So please send all your footage, stories, and any queries you might have to charlie@coachesacrosscontinents.org. So all these information you can find on the last page of the packet. And yeah, thank you, Elvis, for the feedback. I'm happy to hear that you like the Balak clears up the most. It would be great to get more feedback about these games once you have implemented them. Thank you very much for your support, and thank you very much for being on this webinar. We wish you all the best for World AIDS Day and for your activities that you have planned or are going to plan for December 1st, and we're looking forward to hear back from you and hearing more stories about the implementation on the field. Thank you very much for joining in today. Have a good day, have a good afternoon or good evening, depending on where you are around the world, and we will talk to each other again in December, most likely. Thank you very much and goodbye.